are you?
Around yourself.
I am well. I am well. Sleepy, but I'm well. I'm here.
Uh
I got a lot of tea. And the crazy part is it's decaffeinated, so I don't even know why I'd be
oh.
it's not gonna do anything for me. Uh, I'll play some music and I think the energy will come. All you gotta do is let the beat drop. It's a wrap. So
All right.
how you doing? How was your week?
Um. It yesterday was interesting.
Wasn't it though?
Oh.
And we're gonna talk all about it today.
So basically, I didn't work yesterday.
Well, look at you. I'm sure probably most people did. Ooh, and then the conspiracy theorists are running amok.
Uh, you cannot have an event without a conspiracy
You
theorist.
cannot. Not in this day and age. Not in this day and age. It's all
But
over the
they
place.
keep things spicy.
They don't they? Don't they? That chai tea latte spice, don't they? Other than that, how was your week?
It was good. Yeah. Well, the good thing is, I'm done doing my extra duties at work. Yesterday was the last day. So
Okay.
it's because the we have a manager and we have a supervisor. The supervisor was on FMLA, and then the person who was filling in for her was on 2 week vacation. So I had to. So I'm just so glad.
They was coming to you. You were the HI. You was the person to come to.
I had to do the census and then the staffing numbers.
Oh
So
wow.
and
Wow.
and I'm not an early riser. Starting at 7 was a chore. You hear me?
That's why I appreciate you every Saturday morning because I know.
See, I mean now I mean 8 o'clock is good because I get up at 8 for Saturday, but getting up at 6:30.
I get up at 5:30
So,
every day. Well,
so,
my alarm goes off at 5:30 even on Saturdays. Some days I'll rise and do stuff. Some days I'll wait and get out of bed about 6:30. So it just depends.
mm, got it.
He like, bless your whole heart,
Yes,
huh?
yes.
Ah,
But see, when you go to bed early, see, I'm
I
up
do.
at
I
twelve
do.
thirty, like I'm ready to go out.
Oh, Lord. I'm sitting there. Let me be somewhere and it's like 11:30. My eyes watering. I'm looking around. I'm
Oh,
like, I gotta go home. Y'all see me in the corner sleeping somewhere. Unless I've had a nap. Now, naps are wonderful things. I always say you can cure everything with a nap and a bath. Wonderful things. So if I've had a nap, you may get a few more hours out of me. But if I'm straight all day, no. You better have a bomb DJ. Let me just say that. The party better be a party. And then I'll suffer the next day. But yeah. All right, let's get started. Well, welcome everybody to our Saturday morning tea, where we discuss health information, news, education, certification tips, early mornings, late nights, entrepreneurship, and the revenue cycle at large. As you come in, don't forget to hit the thumbs up or like button. I am Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio, that specializes in revenue cycle and regulatory compliance and education. And business is booming. Well, let me ask, do you know what it takes to be a certified marketable medical coder? Do you? Well, before I introduce my co host, let me share with you information on a free, free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/certified www.clarice.com/5stepscoder. See, the beat getting me a little bit. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check the video description for the link. Now, joining me today is my partner in success. Thank y'all. My co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia, Pennsylvania. I have been in healthcare as a nurse for a mighty long time. In 2014, I transitioned away from the bedside into HIM and medical coding. And in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other people in healthcare with a clinical background transition into the wonderful world of HIM.
And how's that going for you?
It's coming along.
Yeah.
I am finally getting ready to, I have to start some promo and advertising, but I'm finally getting ready to start another class next month.
Okay.
So I have a tentative date, but I gotta formalize some stuff.
Okay. And you know we have church announcements, right?
Yes.
Okay.
Yeah.
I'm just saying. All right. So let's see. We got some comments. Let me check out what's going on. Good morning, Tanika. Good morning, Tasha. Some of them do. There are some that are on an island alone with their theories. Right.
Yeah.
Said not a chore. Oh, see, I'm up late, but I get up early too. Girl, bless your whole heart. So you sleeping what, 4 hours? I don't understand. I gotta have all of mine, all of them. Good morning to our on the street correspondent, the crafty coder. Good morning. She says, I'm up late and early too, Tanika. My brain has to have some time. Ma'am, I'm just gonna let that slide. I'm gonna just keep scrolling. I swear I'm gonna let that slide. Because that explains a whole lot right there. Don't it? Okay. It wasn't just me. Okay. It wasn't just me. All right. So before we jump in, let me remind you that today we really gonna have conversation. Because I got questions for y'all. I'm just gonna fire away, asking some questions, getting some opinions on your thoughts on what is going on in these healthcare IT streets. But let me remind you that you can join in and add to the conversation. Don't be shy. Y'all know better than that. Y'all know it's nothing but love here. This is community. Your opinion matters and is welcomed here. So most folks know, use the chat. Place your comments in the chat. If you have a question, please type Q first so that we know that it is a question for us and we don't miss it. We hate to miss any of the questions. So we're both watching and we try to catch them, but if you throw the Q in, that'll help us immensely. So for those who are just joining us or watching the replay, today we are talking tech meltdowns, how one glitch paralyzed healthcare. And all kinds of industries as well. But since we focus on healthcare, let's talk about what happened in these healthcare streets. But first, let's get into our church announcements. It's a little too cool for fans, but it's all this way. I thank God for the coolness. Ooh, this weather has been crazy. So, this week has been a doozy. I believe the outpatient perspective payment. I thought I saw something about the proposed rule came out, I believe. So there's some, I'll be reviewing that and dropping some information related to that. Here in Cincinnati, we have Black Tech Week. Why was I trying to do 500 things in a week? Let me just say that. But I got some of the things that I wanted to do, mission accomplished. I got to see Ava DuVernay. I was so excited. That was the primary reason why I wanted to go and listen to her talk about storytelling, which was very, very impactful and insightful because she talked about storytelling, of course, from her industry, which is filmmaking, but she parlayed the knowledge into storytelling from the tech side, at least from the side that some of us are on as we do videos and podcasts and have our digital imprint out here in the world. So it was really, really interesting to hear from that perspective. And one thing I wanted to repeat that she said to everybody is that we all have a story, all of us. And one way we all know that we have a story, particularly when we be like, girl, let me tell you, that is the beginning of the story. And so we all know how to tell a story because you started with, girl, let me tell you, and everybody like, whoa, wait, hold up, this is important. And you weave all the information through that story, building it up, bringing it down, hitting the punch. We know how to do this. It's just a matter of taking our stories and doing that on a broader scale. She even was like, how guys be like, man, this one over here, da 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 da, so she went through all of that. So it was like, you are absolutely correct. And even if we are all in the same place, say watching all of the same things, we get a different perspective from it because of our lived experiences. And so just because someone may be doing something that is similar to you or like you, stay in your lane. There's no traffic over here. So do how you do, move how you move, because you bring your own unique experiences to it. And so, keep your blinders on, keep your eyes on the prize. You don't necessarily have to worry about what somebody else is doing over there. Let them, we always say there's plenty to eat at the table, plenty. Let them do what they do, but you do how you do, and nobody can do it the way you do. So those are a couple of the gems I wanted to bring back. But it was fun. We had a nice time. TD Jakes was here. Unfortunately, I was not able to see him, but I stole somebody's pictures that they took with him here as proof that he was actually here. He had a session. And the one thing about this, it was this, I think this was the second or third one they've had here in Cincinnati. It's not like a conference that I'm accustomed to. And maybe, see, my bouginess, I think, came out, and I'm like, well, where's the exhibit hall? Where's the swag? Where's the stuff? I'm used to that. Now, they used to partying. So after the sessions, it was a happy hour, it was an event, it was a party, it was something, a food, drink, all of the things afterwards. I'm like, we do a little of that, but most of the times we tired because our sessions start so early. We might have one big day where everybody comes in. It's like the closing, and they had a closing. I did go to the closing. But I was like, but I had to remember, it was multi-generational, mostly leaning toward the Z's, X, and Y's, and all of them people. Love y'all. So it was interesting, but they came correct. They came. There were people from all walks. Like, I saw people in the music industry, film industry, tech. Now, if you working in IT at any level and you was looking for if you unemployed in IT, everybody there was looking for somebody to hire. like on the spot, like everybody. And they were giving me, do you know somebody and so and so? I said, I'll take the information. I don't know, but I'll take the information. I mean, they had a small vendor little area, and all of those with a little swag. So I did get a little bag of some swag. So all of those people actually were looking to hire people. And I was like, well, I remember there was a whole, a little while ago, they were letting a lot of the technical people off. But yeah, and I won't say ironic, but it was wild that this all happened that we're gonna talk about at the end of our Black Tech Week. Actually, I had a gentleman talk about it, who is here local, and he was saying he had some thoughts on it, and it boiled down to Q&A, like having a quality assurance testing, and having those teams and having people to do that work, because this, in his mind, it could have been avoided. He was like, thousands of talented IT people he was talking about the Tech Week. He said, I'll start with getting that list, especially you, Microsoft, for all the people who were looking for jobs. He was like, I have more theories on what went wrong. He's like, but I don't want to get too techie. But he said, whoever was or is currently on your QA and testing teams are probably looking for jobs. And that was a letter to CrowdStrike and Microsoft. Like, it could have been just a matter of making sure all I's are dotted and T's are crossed. And they're thinking maybe that's something. Oh, and then someone else mentioned about offshoring. There's a lot of offshoring in IT as well, and either they're offshoring or they're hiring people who are coming in on green card work visas, etc. So it's all kinds of conversation in these streets, but just wanted to give you a little. I'll do a video about all of this, but just give you a little information about the Black Tech Week. Yes, sir.
Can you please read the Crafty Coder's comment?
Oh, wait a minute. Let me see. Oh, Lord. Ma'am. You should have worn a Cuban link and not your pearls. The pearls gave bougie vibes. Ma'am, you know I do everything in my pearls. Absolutely everything. Y'all funny. Good morning, Carolyn. Good morning. 500 things in a week is where I live. I try not to live over here because it's killing me. And I still have a couple more things to do this week to get out. Like literally, I had on the day that on Thursday, Ava DuVernay was here. I was actually taking our seniors. We did a senior trip to the where did we go? The Freedom Center, and they had a exhibit for the Green Book, which I love. That Green Book. If it comes to a city near you, check that out. It's really good. So I was like, okay, I've been to the Freedom Center before, so I only wanted to see the Green Book exhibit. So I was like, okay, we got everybody settled, and then I took off and ran about 5-6 city blocks up the way to where our Aeronaut Center was, so I can go see Ava DuVernay. And then I ran back down and saw the Green Book. So yeah, I was doing too much, way too much. Yes.
Right,
Not the bougie vibe. I should have had a whole drape of pearls, but I didn't. I just had the one strand. That's all.
So the Crafty Coder's comment about 500 things in a week is where I live. And Crafty Coder, and 400 of those things have nothing to do with you.
Oh, ouch. Ow. That's coming from lack of sleep. Early mornings and late nights. Y'all funny.
I had yesterday during this, I had a coworker who had sent me a message on Teams who was trying to come up with this workaround. I said, "You doing too much." I said, no, we don't need to be trying to figure it out. We need to wait until we get full functionality. I'm not doing double work. No.
I
Why
know that's
they
right.
gotta come back and finish it? No, no, no. Just wait.
Just chill. Just
Look,
chill. That is funny. That is funny. All right. All right. Well, let me. Did you have any additional announcements? All right. All right. Let me.
you,
Oh, good Lord. Usually have nothing at all to do with anything. Y'all are funny. Y'all are funny. Oh my God. She said random rabbit holes, and you fall in them every single time and be digging new paths. Like, ma'am. Oh gosh. All right, all right. So let's get into this. Let me turn this down. So I had another real quick before we get into our topic. Happy
thank
birthday!
you.
Happy birthday!
Thank you.
I was like, oh, the way you talked about you be ready to go at 12:30, you might be drop dropping it like it's hot somewhere. Ah, all right, all right. So let the tea spilling. Uh-oh, wait a minute. Hold up, hold up, hold up.
Lucas Garcias, Carolyn.
Look, I said, wait a minute. I don't even know how to say that. How do you say that?
Feliz cumpleaños.
All right, all right. Look at you. Look at you. Look at you. Yes, yes. Happy birthday. Happy birthday. All right. So we're again talking about the glitch that paralyzed healthcare. Now, the crazy part is, have we really recovered from the cyber security incident? And now this, like, wow, this, ooh, child. But anyway, so sometime during the wee hours of the morning on July 19th, a global IT outage rocked the healthcare industry. The culprit is a faulty software update from CrowdStrike, who is a major cybersecurity firm. This update caused devices running Microsoft Windows. I'm so glad I'm a Mac person. It's Microsoft Windows to crash due to compatibility issues. It's crucial to note that this wasn't a cyber attack, as they say, or a security breach, again, as they say. It was an unintended consequence of a routine update gone wrong. But the impact, we all know, some of y'all experienced it firsthand, was massive. So the fallout in healthcare was immediate and severe. Electronic health record systems were knocked offline in hospitals across the country. So imagine the chaos. Y'all saw all the stuff. I don't really think they showed a lot of, at least I didn't see a whole lot of coverage around hospitals. Most of the stuff were folks being grounded in airports. I saw a whole lot of airport stuff. But imagine the chaos in a hospital. Doctors and nurses suddenly unable to access patient records, medication lists, or treatment plans. Many hospitals were forced to cancel non emergency procedures and delay services. Some even had to divert patients to other facilities. And then, in extreme cases, even emergency 911 call centers were affected. It was like stepping back in time as healthcare providers scrambled to use paper records and enact downtime procedures. Yeah, we're going to talk about that too. Okay, so then let's look at some specific examples to understand the scale. Mass General Brigham, one of the largest health systems in Massachusetts, had to cancel all non urgent medical visits. Kaiser Permanente activated its National Command Center to deal with the crisis. Epic, one of the largest EHR providers, saw some of its cloud based services impacted. Other major players like Cleveland Clinic, UPMC, and Harris Health System all reported significant disruptions. And this wasn't isolated, it was a nationwide problem affecting healthcare providers of all sizes. So, to give you an idea of how widespread this was, some organizations reported that up to 10% of their Windows based devices were impacted. Now, that might not sound like much, but in a hospital setting, that's potentially hundreds of critical devices, from workstations used to access patient records to systems controlling medical equipment. The disruption was far reaching and severe. Healthcare organizations didn't sit idle. They immediately implemented downtime protocols, which are procedures designed for situations just like this. IT teams worked around the clock to restore access and functionality. Epic, the EHR giant, had their staff collaborating directly with customer IT teams to find solutions, and it was all hands on deck across the industry. Now, this incident exposes a critical vulnerability in our healthcare system. We've become so reliant on digital systems that when they fail, it can paralyze entire hospitals. It raises serious questions about dependence on technology and the need for robust backup systems. Moreover, it shows how a problem with a third party vendor can cascade through the entire healthcare ecosystem. So, if this situation feels familiar, it's because we saw something similar just 5 months ago with the Change Healthcare ransomware attack. While that was a malicious attack and this was, quote, an accident, the end result was similar: widespread disruption to healthcare operations. It underscores the need for better preparedness and resilience in our health IT infrastructure. The financial toll of this outage is still being calculated, but it's likely to be significant. Canceled procedures means lost revenue for hospitals. Staff working overtime to manage manual processes adds to costs. And there will likely be delays in billing and claim processing, further impacting the cash flow of the organization. It's a stark reminder of how intertwined our financial and operational systems are with our IT infrastructure. So, perhaps the most concerning aspect of this outage is its potential impact on patient safety. Without access to electronic records, there's an increased risk of medication errors or treatment delays. Allergies might be missed or crucial test results overlooked. This is why having established downtime procedures is so critical. It can literally be a matter of life and death. So, what can we learn from this? First, the importance of robust backup systems and offline access to critical information can't be overstated. Hospitals need to regularly drill their downtime procedures to ensure staff are prepared. And there's a clear need for improved resilience in healthcare IT infrastructure. We need systems that can fail gracefully without bringing entire hospitals to a standstill. This incident is likely to have ripple effects in the regulatory sphere. We might see calls for increased oversight of healthcare IT vendors. There could be new mandates for certain backup or redundancy measures, and I wouldn't be surprised to see updates to cybersecurity guidelines for healthcare organizations. The goal would be to prevent something like this from happening again, or at least minimize the impact if it does happen again. As for the recovery, CrowdStrike and Microsoft worked quickly to resolve the initial issue, but getting all affected affected systems back online and fully operational took time. Some organizations were up and running within hours, while others took a long time and still taking time to fully recover. The long term follow up will be crucial, ensuring there are no lingering effects and that all patient data is accurately restored. This incident will likely prompt many healthcare organizations to reevaluate their disaster recovery and business continuity plans. And then yesterday, the CrowdStrike founder and CEO, George Kurtz, was offering up an apology for his company's software update that sparked a global cyber outage. And I think they said he showed up on the Today Show, again, stating that it was not a cyber attack, it was just an update. And, he was really sorry for all of the things that had happened. And this is now reported to be the largest IT outage in history. And so he, in this article, I'm looking at an article from TMZ. All you see are the people in the airports who are just over it, and you see all of the blue screens that they referenced, which I would have panicked. And Lord, please let this be taken care of by next week while I get on the plane. Lord, please, I'm praying right now, please, so I can get to my destination and back safely. But anyway, yeah. So that was all of the things, Mr. Jesse. I didn't know if you had any comments.
I just, it's just so interesting how they don't, like they're, 'cause, I worked in IT like ages ago, and they used to always talk about redundancy for this very reason.
Mm-hmm.
And first of all, you're supposed to test things out first before you roll it out. So I
Mm-hmm.
don't know how this even was able to propagate like that, and why they weren't able to. Well, I guess they probably could. They probably found it, but then you have to go and have everybody reset to what it was before. So that probably took time. But I just don't understand how these things continue to. Well, I do understand how, because now everything is centralized.
Mm-hmm.
Whereas before in IT, that was never a good thing because of this very thing. Because if you have things, if you have redundancy, if one system is not working, you can just offload everybody to the system that is working while you fix that.
Yep.
So I really think that because of what's going on, there's going to be some legal changes because
I
this can't continue.
I agree. Crafty Coder says, I am over this IT stuff for real, for real. UPS wasn't even open. Wow. I don't believe anything they say. My thoughts, this will open more revenue opportunities for the big IT companies. Google, Apple. Girl, why are you throwing out the index
Mhm.
names? We're in a very important election year. Yes, you're absolutely correct. Absolutely correct. They did
Well,
say, I think the crowd strike thing. I think their stock went down. I didn't see anything. I'm sure Microsoft probably did too. But yeah, right.
well,
You was hitting them numbers, and I know them because I'm out there in them streets. But yeah, go ahead, Mr. Jesse.
I mean, well, Amazon is already knee deep
Yeah.
because that's what that, like, the web services, like, they provide cloud services for most of the federal government.
Mm, mm. So, what do you think? So, on a scale, and you all can put your answers in the chat. On a scale of 1 to 10, how confident are you in your local hospital's ability to handle a major tech failure? And have you ever experienced a delay in care due to technology issues at a healthcare facility? And if you have, what happened? She said minus 4,000. Ma'am, wait a minute. Said nine. Okay. Not minus 4,000. Ma'am. Ah, goodness. Um, so from a from HIM perspective or HI perspective, how has your organization updated its downtime procedures in light of this incident? And I guess I know I know in previous organizations, like we talk about the downtime procedures, and most folks knew, there's some paper in these file cabinets over here. If we ever had to pull them out, you could go get them. But were folks really trained on those downtime procedures and then what to do with it? So I think, to me, that part is concerning. I don't know that folks really know how to operationalize what that looks like. Some folks probably ain't never seen paper charts in their entire career. And what is all of this? How do I do this? And so I think that's going to be an interesting take on that. Just that not one lick of confidence, they react versus being proactive. Exactly. We recently, within the last 2 weeks, went through downtime process. Well, you guys were ready. That's what's up. Good morning. Good morning. That's what's up. Um, I'm just curious, like how is there regular training on that? Is that something that folks are are implementing in their facilities on a regular basis and keeping uh, top of mind? Especially, I mean, now this is the second one. I mean, at a bare minimum, you would think folks would be like, okay, let's make sure everybody understand what happens, or not. Maybe folks was just like, what, and had the luxury to do that. Just close the doors. We're closed today. We're not fooling with this. We're closed. Everybody go home.
I mean, and for me, like where I work, we don't have a downtime procedure because we can't do anything.
Oh, okay. So y'all had a day off or a
Well,
day on that was off.
what they did was, since it wasn't their fault,
Mhm.
they paid us for 4 hours. Then they gave us the option of either using 4 hours of PTO, or we had to let them know when we were going to make up the 4 hours.
Mm,
I just used 4 hours of PTO.
mhm. Okay. Okay. All right. So let me see what else did I want to ask. What role do you think patients should play in ensuring their own safety during healthcare IT outages? And in light of this incident, would you be more likely to ask your healthcare provider about their backup systems and downtime procedures? Like, these are things you don't necessarily think about. Um, you just going to get your care, just going to get your annual checkup or whatever it is. But
I
look at
mean,
all the things you now have to worry about. And then especially because there was a lot of people that and because Epic was involved, rely like on my chart or rely on, the information from that. And then if they can't get that information readily, that could be a problem. Clearly. What were you gonna say? I'm sorry.
I don't even really think, and especially because of these larger healthcare systems and with all these providers under their umbrellas, I don't think that these local practices, these local offices have much, autonomy to do anything.
Mm,
And the only thing they probably could do is do what they do, go to, the paper system, in the meantime, and then, cancel anything that's not, emergent.
mm. Another thing to consider is maintaining HIPAA compliance during these IT outages, because again, things, depending on what your downtime protocols look like, some things may not. I mean, if you're writing on paper, where is that paper going? How is that paper being stored? How can you ensure that things don't go missing, things don't get copied, things don't, all of those things. So how I'm curious if folks have had even thought about the HIPAA implications of these additional or these alternative operational protocols during these IT outages. And they one of my other question was training your staff on manual processes. Like how often does that happen? And then what tools or methods are folks using to track and reconcile patient data during downtime periods? Like, are they making sure that, everything is captured, nothing is necessarily lost? Let's see, she said patients should inquire about downtime procedures at a high level, and patients should definitely want to know how it impacts billing and patient information privacy. Absolutely. Absolutely. Oh, and then thinking about accurate patient identification during system outages. Like what are some of those what are those things? And as a HIM professional, or HI professional, um, how how should we be involved? Which how should we help or assist in evaluating and selecting more resilient health IT systems? Are we at the table when these conversations are happening, or are we part of the decision making, or are we just okay? This is what we did. This is what you need to learn. Have at it. And then, do we collaborate to improve system redundancy and failover processes? Collaborating with the IT department and other related departments at that. And then if you are in compliance, again, how are you ensuring continued compliance with HIPAA privacy and security rules during these outages? What processes have you implemented to maintain an accurate audit trail when reverting to paper records or manual processes? Oh, what steps are you taking to ensure compliance with CMS's condition of participation regarding medical record keeping during system failures? Um, of course, any compliance risk related to billing and coding accuracy when working with limited electronic resources. For those of you who are you only rely on your encoder, how's that working out for you during these types of times? Do you know what a book is? Have you ever cracked open a book? Can we look at an index? There are guidelines in the book, right?
That's a whole mess.
And then, so from the revenue cycle perspective, how are you mitigating the financial impact of delayed billing and claim processing during EHR outages? What strategies have you implemented to ensure accurate charge capture when reverting to manual processes? Same way with, what steps are you taking to maintain coding accuracy and compliance when coders can't access the full electronic record? You probably just want to shut down for the day, like they did at your place. Just shut it down. Shut it down. What strategies are you using to prioritize and manage the backlog of billing and coding work once systems are restored? Are you ensuring proper documentation to support medical necessity when electronic clinical decision support tools are unavailable? You got a lot of stuff going on. And even as we think about AI and how, there is in some circles a reliance on AI to do a lot of the things, Well, AI goes down when the system's down, right? Okay. All right. So then what? Then what? Um, and I don't know if, again, thinking to the crafties coder's point, if we're really being proactive in our thinking related or around this, or just reactive as it is in this particular case. Mm. And then we still got COVID out here, right? So how might widespread EHR outages impact our ability to detect and respond to disease outbreaks in real time? Um, this is from a public health perspective. Um, how can we better integrate public health emergency preparedness plans with healthcare facilities IT disaster recovery strategies? So those two different things, but are we talking? You know, the public health realm kind of have the tools and systems that they use, but we already know that some of those systems don't necessarily jive with what's happening at hospital systems. But now you have an even bigger problem that, one, they may all be on Microsoft, but now it's even further fragmented because everybody is down. How might these types of outages affect our ability to accurately track and report on key public health metrics and indicators? Um, how can we ensure that critical public health data like immunization records and reportable diseases remain accessible during system failures? Um, yeah. And then what strategies can public health professionals employ to support healthcare providers in maintaining essential services during IT outages? And then also improving communication between healthcare facilities and public health departments during IT related emergencies. So it's a lot. You know, we again were at least all I saw was, you know, folks have a blue screen. It was really impacting the travel industry and financial industries and the business sector, but it's really really impactful and important for the healthcare industry and just a lot of things to think about and a lot of things to consider as these things happen. Mr. Jesse, did you have you look you deep in thought?
No, because some of this is really, it's really high level policy making that has to take place,
Mm-hmm.
policy decision making that has to take place.
Mm-hmm.
And I just don't know if that's really going to happen in an effective way.
Mm-hmm. Mm-hmm.
I really don't, because it takes a lot of collaboration. But
Absolutely.
when you don't control the process, I don't. you're kind of limited to what you how you can respond.
So when you all go, not you,
Mm.
you personally, but as you um have your huddles and meetings and that kind of thing, you know, just maybe asking some of the questions or think, you know, asking to find out. So what does this look like, you know, um to to those supervisors or managers or directors who then can possibly hopefully take it up to the next level so there can be a grander conversation, because I know, you know, a lot of us are at a level where, you know, it trickles downhill. But maybe, you know, poking the bear a little bit and saying, hey, you know, have had you all considered da 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 da. Again, this makes you a little marketable because you're bringing some information. You're doing an environmental scan, if you will, of what's current and um, how it's impacting, one, your organization, two, of course, your patients, but three, your profession. So this kind of allows you to bring some critical thinking skills and prayerfully help things go along, move along, give somebody some food for thought. Then folks will be like, well, wait a minute, well, what are you? what are you thinking about this? Or how did you come up with XYZ? Or what are your thoughts or whatever? And it's like, oftentimes we don't even consider um, the implications. Like, unless you had like an appointment yesterday, you might not even consider, um, how that may impact somebody. Or say you needed medication and something had to be, they had to get information from the provider. Well, all of that is electronic. And if folks are taking time to try to figure out what is happening, or don't have the proper protocols, or can't get information from any system, then that can ultimately, that's a patient safety issue or patient safety problem. And that could be a life or death situation, as I stated before. That person may need that medication like now, and unfortunately, there may be some delays in getting. Prayerfully, they will get it, but there may be some delays in getting it. And so, how will that impact that patient, and whatever healthcare challenges they may be experiencing? So it's a lot. You really have to just. It's a lot, way more than we ever really consider or think about. And then, um, to the other point, once this is done, and like a lot of people are still wrapping their heads around what happened with the cybersecurity attack. Well, now you got this added on it. So now this is additional, depending on what part of the healthcare industry you're in. Now you got to wrap your hands around this and all that comes with, this particular interruption, and the time, and the talent and everything that now is going to be required to clean up the mess that was made. So it's a lot. It's a lot. A lot. And then I didn't even think about this. I'm thinking about healthcare in general, but what about even like in education? So what if somebody was testing? What if somebody was sitting for their examinations? What if, and they were using Microsoft systems, some stuff like this impacts a whole bunch of folks and a whole bunch of stuff.
What I find interesting is not everybody was affected because I talked to um, one of my friends who she works in coding too.
Mhm.
They she worked all day. I don't know what what this crowd strike did that
Well, I think it was a specific patch to something, so, and you're right. Maybe everybody doesn't have um whatever that was. I don't know, because you're right. And then not all EHRs were impacted as well. Interesting. Interesting.
Mhm.
Like how you ducking and dodging these bullets. So
So
interesting.
there's some more information that we need to know because I'm like how because I just assumed it affected everybody, but at first, but it didn't.
Mm-hmm. Mm-hmm. Oh, Tanika said she worked all day. Oh, so you ain't get the option of shutting it down. What EHR system do you use, if you mind sharing? Epic. Oh, she's on Epic. Okay.
But here's the thing, like where we worked, Epic wasn't affected. It was 3M.
Really?
We couldn't get into 3M because 3M now is where they want us to do the bulk of the work, and that's where they generate all their reports. They don't generate reports from Epic. And
Mm.
people were using people said that they could use Epic. That's where I told my
Oh, where they were trying to do the
they
workarounds.
were doing too much. Oh, and they use 3M as well, but ours wasn't working.
Wow.
You could
That
get
that's
in.
interesting. That folks are doing well. I just said folks could be in the same place and it's seeing the same thing and experience something different. But that's interesting. Um, how folks would have the same systems, but the variances, um, from this. Yeah, she said no problem at all with 3M yesterday.
But
Wow.
I wonder. So, um, this is a question for Tanika. So, Tanika, when you access 3M and Epic, do you have to go through Citrix? Because we have to, and maybe it could have been, you know,
Something related to them.
yeah.
Yeah.
Okay, she said, yeah, they use Citrix. So,
Hmm. Interesting. Interesting. Well, those were my thoughts on all of these things. Just things to think about, and like we said, the conspiracy theorists do come out. Probably more to to this story, and to your point, Mr. Jesse, it's really interesting just seeing how folks can be on the same systems, but not. Like, what's the difference? What's the Did they pay a little more extra money than the others? I was like, I don't know, but what's the difference? Yeah. Uh-oh. Here's a rabbit hole.
uh,
See what I'm saying? Inconsistent as heck. Yeah. Yeah.
well, they can't blame this one on offshoring. Maybe not. Who knows
Maybe
where
not.
CrowdStrike is, where their headquarters are? I don't know.
I think they're low. I'm not local. I think they're on stateside. He said what's weird is that we had issues with Epic and 3M 2 days prior to this. Hmm.
I
So
mean,
maybe
these
y'all were on an early implementation or something. I don't know.
look, these poor IT folks. I know they catch it.
Fit to be tied. Do you hear me? Fit to be tied. And I saw somebody talk like, dear, we IT professionals, we are tired. We've been working around the clock, all hands on deck. And folks just not they're just not nice. They're not kind. Like, we didn't do it. We trying to help you. We trying to fix the problem for you. We didn't do it. And folks coming at them with the rah rah. It's like, she like, see. That is why you are on the site correspondent.
It's just I don't know. It's just it's an interesting time. 2024 has been a year,
Hasn't it? Hasn't it?
and
Hasn't
well,
it?
I'll say since Thanksgiving because last year was the first cyber attack. It was the day after Thanksgiving.
Mm-hmm.
So since last November, it's been a time.
Mm-hmm.
It's a lot going on.
There's just a lot, a lot going on. Mm-mm. He said 2 weeks before Change Healthcare breach, we had an outage all day. It was so random, but not really looking after the fact. Yeah, crazy, crazy.
I just think they're going to have to build some redundancy back into the system and not rely so much on centralization because it all I mean logically and on paper and I'm sure for revenue sake it makes sense, but for these things like you can't have entire systems and entire industries being shut down.
Crippled, like,
Exactly.
just
You just
nothing.
can't, like they're going to have to build some redundancy back in.
Yeah, yeah.
That's the only way you can really avoid it.
And I think, in this time of saving money or being fiscally responsible or whatever, sometimes you got to pay money. Sometimes you got to spend. You get what you pay for. Sometimes you need to spend that dollar to save it somewhere else. Like,
And I mean, and that's the whole purpose of insurance. Like, you have people who pay a high premium for certain things, but when certain things happen, okay, well now you see why you paid for it, even
that's
though
right.
You might only need to use it once, but at least you had it
At
when you
least you have it when you need it, and it's better to have it when you need it than not.
exactly. And that's where these companies are going to have to start thinking about redundancy. It's not just about spending extra money. It's about giving that extra layer of security and comfort if something should happen.
That's right. Because here we are. Here we are.
And it's
And
only going to get worse. It's not going to get better. This is going
that's
to
why I was just saying, who's to say another one is not, even though, this particular organization, I'm sure other organizations are probably scrambling, like trying to make sure, because, they all have different updates and different things that they have going on a regular basis too. It's just making sure that they have the appropriate manpower and people in place to do the checks, make sure everything is right before they put it out there.
hmm
And she said there are still some providers still waiting to get paid from the Change ransomware attack earlier this year. Absolutely. And so now, if they were also impacted by this, imagine that's just going to go further and further along. And then, all they wanted to do was tell you, oh, you can take out a loan and we'll
Look,
you can pay us
look,
back with interest.
exactly. Look, we messed up your system, but we're going to loan you money and make money off of your mistake
Right.
by us.
And then as the conspiracy theorists, and learn about your stuff so that when it comes time that we may need to buy you, we already got the intel. We don't even have to do no additional due diligence. We know what's going on. You ripe for the picking.
Exactly.
Oh, amazing. All right, y'all. So again, these are just some things to think about when anything IT related, because it touches everything now. We are so reliant on this technology in all areas of our lives. Just things to think about. Food for thought. All right.
Yep.
All right. All right. I wonder if it's going to delay some things. There may be some delay in some of our regulations and delay in some of, it just the trickle down impact is going to be interesting to see as it all unfolds.
Definitely.
All right. All right. Well, show my. Ding. And I better have something for you. I'll double check when we go to the meeting after the meeting. But did you know by becoming a Patreon of ours, you're joining a community of individuals who share a deep appreciation for the intricacies of healthcare revenue cycle? Here's what you can expect as a valued Patreon, patron, and member of the Tea Sippers. Yes, we are exclusive, the Tea Sippers. Exclusive healthcare insights, so you can gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. You get early access, so you can be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth and community connection. I think the best part of it all. Join a private community of healthcare professionals where you can network, share experiences, and collaborate on finding solutions to common challenges. So, by supporting us on Patreon, you're not only advancing your healthcare knowledge and career, but also contributing to the group and the success of us all, which allows PRN to be a resource that empowers healthcare professionals like you to thrive in their roles. So, thank you for considering becoming a Patreon. Check out the link in the description of the video. You too can be a tea sipper with us. And one of the things that we provide for you every Saturday is the meeting after the meeting at 10:15 a.m. Eastern Daylight Savings Standard Time, whatever it is that you call it. Oh, Eastern Time. Eastern Time. Your support means the world to us, and we look forward to helping you excel in the world of health information. So again, thank you all. Thank you all for joining the Saturday morning tea or checking out the replay. I know we didn't do a lot but it was still all relative and all related. I think it provides an opportunity for us to kind of consider how all the stuff that's happening in the world impacts us directly, either, through getting a day off or some time. But look at that. Like, you got to make choices. Either you got to come back and work some more time, or you have to use the time that you have. So it still ultimately impacts
Yep.
you as decisions are being made about how to navigate what's happening in the world. And to Mr. Jesse's point, it's still gonna get more interesting and interesting as the time goes on, because we got all kinds of stuff that's happening in the world today. Mr. Jesse, did you have any last or final closing thoughts?
No. I
Okay.
Once again, it's another great week.
Yes, yes. So was the tea spilled today? If so, make sure you put your teacups in the chat. Put your teacups in the chat. Also, if this information was valuable for you, help us share this message with others by sharing the video and subscribing to the channel, Professional Reimbursement Network. Be sure to follow us for more information on all things health information, compliance, revenue cycle, and medical coding. And as you leave out, don't forget to hit, I'm trying to get your teacups. Don't forget to hit the thumbs up or like button. Also, check out the Coding Nurse channel on YouTube and Instagram and all the different places that you are. I think he's everywhere as well. So again, this has been a great session today. Thank you all for joining. See you tea sippers at 10:15. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, have a great weekend, and talk to you soon. Bye-bye.